Well, good morning, everyone, and thank you so much for joining us. My name is Chris Collins, and I'm President and CEO at Friends of the Global Fight based in Washington, D.C. Today's session on global health finance follows from a hybrid convening in April of this year led by Results, the One Campaign, and Friends. We discussed options for bringing increased financing to global health through both traditional and innovative methods. We discussed overseas development assistance, domestic resource mobilization, partnerships with multilateral development banks, and increased private sector investment. And last month, our three groups came out with a report based on the convening, and it's on the Friends website at theglobalfight.org. It's also, hard copies are available in the room. I think Isabella has a lot of copies there. It's called Expanding Global Health Finance. And I think what makes the report different is that we propose an action agenda for multiple different stakeholders in this space. The report also includes some suggested principles as we go forward to expand the array of financing options that are utilized in global health. And some of those principles are additionality. In other words, we need new money in global health finance, not just to replace current financing. We need to be oriented around results in the way that we finance health services. We need to build in equity to the deals we make with the private sector, international financing institutions, and other approaches. And first, do no harm. Don't do financing approaches that exacerbate debt challenges or shut out communities from the dialogue. A major takeaway from the convening and the report is that overseas development assistance remains absolutely essential and has really unique attributes that you need in the game of the full financing picture. So our point is we need to bring new finance to health, not replace ODA. Attendees at the convening put forward a range of ideas for where we can do more, and many of these, or most of them, are already in play. And for the question is, and I hope one of the things we can talk about today is, how do we bring those to scale? What are the action steps to getting to scale with the things that are working in finance? Finance options discussed at the convening included overseas development assistance, increased domestic resource mobilization through a variety of means, debt for health swaps, health insurance schemes, blended finance and increased concessionary lending from international financing institutions, certainly debt relief, de-risking of private sector investment, more use of special drawing rights, and other approaches. So there's a lot of ideas out there. And this is a complex field. And in fact, I think one of the challenges is that global health people and finance people, we simply don't talk to each other enough. And so that's one of the things I think we can all collectively talk about, how to work to change that so that there is more connection between global health and financing dialogues. And one thing I hope we can discuss today too is how to build capacity within institutions and information sharing between stakeholders to more fully leverage the diverse opportunities in financing. What we do know is that we need more investment in health overall, and as policymakers increasingly emphasize transitioning health to country leadership and sustainability of these responses, we have to create a menu of options for countries that is up to the task of providing the necessary resources to continue our progress in health outcomes and also to leave no one behind, including the most vulnerable in our societies. So today we want to speak with four wonderful leaders in areas of health and finance about what they see as promising next steps to expand global health financing. And one thing I want to come away from the session with is an understanding of what our panelists see as 2 or 3 things they'd like to see happen in the next year that could be real game changers in global health financing. And also, how do we scale things in financing that are working well? Our panelists today are gonna provide short opening thoughts, and then I'll ask a follow-up question to each of them, And then we're going to open up for question and answer with the audience that's in the room. And then we'll have closing thoughts from all of us. Let me introduce our panelists for today. And also let me, again, thank you, all four of you, for being with us today. Ndidi Onkonelli is President and CEO at the One Campaign, which advocates globally to promote growth in Africa and an end to extreme poverty and preventable disease. Rosemary Mburu is Executive Director at WACI Health and leads African civil society advocacy for equitable, sustainable health financing. Agnes Kunfinyal, a global health program lead for health financing at the World Bank. She oversees policy and lending programs that strengthen countries' domestic health financing. And finally, Bonanza Tehitu. He is Senior Advisor to the Minister of Health, Indonesia Ministry of Health. Before I start, also, I want to give a huge thanks to Mike Isabel, who led the preparation of our report and did a lot of the work on our convening, and Isabella Castillo of Friends, who helped put together today's session. So let's start off with a few minutes, 5 maximum, I would ask, from each one of our panelists, and really share whatever you'd like to about these issues that we're talking about, but also really would love to hear your ideas about what are 2 or 3 things you'd like to see happen in the next year that can really be game changers in finance. Ndidi, let's start with you.
Thank you so much, and good morning, everyone. It's a pleasure and honor to be here, and I want to thank Friends, Mark, for your leadership and for your engagement results as well. Thank you. And to my colleagues at the One Campaign, Frida is here, who have worked so diligently on this report and have convened over the last few months because this is an issue that's really important to us at the One Campaign. We fight for the investments to ensure healthier lives and economic opportunity in Africa. And our vision is that Africa is an equal player. And for those who don't know One, we are 21 years old and work across the world, but with a focus on our G7 countries and on the African continent. So the Global Retreat from ODA really marks another wake-up call. But for us, it's too long in coming. In fact, I've had very candid discussions with many of you and many of our stakeholders who say, you know, in the global health community, we saw the trends, we saw the signs. And we should have acted faster and swifter with the pathways to sustainability. But we know that at this time, we must continue to fight for life-saving medicines and humanitarian support because there's a clear return on investment. And at One, we continue to fight for Gavi, the Global Fund, and PEPFAR. But we recognize that this wake-up call and these crossroads also mean that we have to think differently. And at One, we've been convening over the last 12 months, stakeholders, and actually this culminated in what we call the Bellagio Convening Report, which we released last April. And for those of you who are not familiar with it, we'll be happy to send copies. But I think a lot of the great ideas are also incorporated in this wonderful report that we have alongside us. And what we did through these convenings is to really think about what the future should look like and how we can define the future where African agency and African voice leads. And for us, our North Star is that by 2035, at least 30 African countries will be fully self-sufficient, financing their own healthcare. But it is not just a financing issue. We need to see improvements in quality at the same time. And for us, our North Star is hinged on infant mortality and under 5 mortality rates being halved, death rates being halved by the same time. So that we're not just improving our financing, but we're also improving health quality, health access, and lives. To do this, we need ecosystem approaches that are hinged on access to basic health care as a fundamental right and a requirement for all people. We have 6 principles that undergird this. The first is that the health sector must be seen as a driver of economic growth. For too long, we've seen the health sector as a development imperative, a receiving end of the spectrum, not a driver of growth, and not a creator of jobs. And that's often why, as Mark said, the finance ministers and the health ministers don't sit together, and oftentimes the health ministers feel like they're coming with a begging bowl to the finance ministers, as opposed to saying this is fundamental and it actually creates jobs. In fact, we often say at the One campaign that Africa's young population, average age 19, is the health workforce for the future of the world. With the aging populations in Europe and around the world, we can provide the health workforce, which is, for me, affiliated with what the World Bank is talking about now, and the theme of this World Bank meeting being jobs. Second, that there must be sources for local health revenue generation in country, and this commitments to domestic resource mobilization, but also improving the efficiency and effectiveness of health spending, which is leveraging innovation and technology to cut costs, to remove corruption, to ensure that every dollar, every naira, every CD goes to exactly where it's supposed to go, and that we can track it. Reducing the debt distress, which is critical, and this is well articulated in the report. Many of our countries are currently facing serious debt distress, spending more money repaying funds, and we know at the One campaign, we've actually just issued a letter to all the central bank governors and ministers of finance as part of this World Bank meeting, signed by Stiglitz and many world leaders. So I call on you to join that call. Number 4 is domestic financing must be the foundation of health investments. We cannot, we should demand that our financial institutions, our local financial and regional financial institutions, also invest in health in our countries as a source of investment. We need to engage the diaspora communities. And for those who don't know, the African diaspora contributes about $100 billion annually to Africa. And about 14% of that already goes to health spend. But much of that money is spent fighting when it's too late, right, as opposed to prevention. And we've been working with Brookings as part of the 17 rooms during UNGA to design a health bridge in partnership with Insurance Development Forum, a very ambitious roadmap that basically says we want to go from 16% of Africans insured today in many of our countries to at least 30% by 2030. And we're very excited to see the interest and commitment from a broad range of stakeholders. And number 6, really saying how do we have multilateral initiatives such as Global Fund and Gavi adapt stronger domestic capacity and move procurement, data, and a lot of their work, service delivery, to the hands of Africans leading this effort. So as you can see, it's quite an ambitious effort, and we're already galvanizing support. We're piloting this in Senegal and Sierra Leone. We're really excited about the opportunity to scale it much broader. We also are working with governments in the UK, EU, the Netherlands, Nordics, Canada, and the US to continue to develop a clear message on return on investment and shifting power. We actually have shown in the U.S. that Global Fund's investment and partnership with the U.S. has resulted in a $3.5 billion returns to U.S. businesses. So it makes business sense for us to continue to partner. And additionally, at the U.S. team, and Frida can talk more about it, we're really saying, how can the U.S., America's first global health strategy, build research and effective transition models to shift global reliance from ODA to local ownership? So this resonates with us. And I'll end with this. For me, there's a lot of good content in this report, a lot of great work that a lot of us in this room are doing. Ultimately, we have to do it together. We have to be aligned. There's no need for siloed approaches, and there's more need for partnerships at this critical time, where every single initiative is building on each other's work. The 2 things I would love to see us move forward, to your point, Chris, is the diaspora health insurance mechanism, which is getting a lot of support. And the World Bank has done a lot of great work on remittances, and we're building on a lot of the work that many people are doing in this space. But I think there's a lot of energy and fundamental interest in pushing that along for a private sector solutions perspective, but also an enabling environment for governments. The second is really the need to work collaboratively with our global health infrastructure and our G7 governments to support this pathway to sustainability. Continue to support now, build now, so that you don't have to invest in the future. And that North Star, where we're holding governments accountable in the G7 and on the African continent to deliver for their people on this values-based social contract, is, for me, fundamental. And that pathway to sustainability, with success stories and milestones celebrating it, will give confidence and restore confidence to our sector. Thank you.
Thank you so much for those comments. Rosemary, over to you. What are your perspectives on what needs to be happening in the next year to change the game here?
Thank you so much, Chris, for this report, but also for putting together this panel. Good morning, colleagues. I work from Kenya, and I work with communities and civil society from around the Africa region. And so as we approach this conversation and as we look at this report that colleagues have put forward, it really is a critical time. I think just being in an environment where we can see how our governments are struggling to actually balance things, where countries are still recovering, I would say, from the pandemic. Countries have never really recovered. But also, it's a time when countries are experiencing debt distress because of long-standing debt, but also because of, the challenges of the pandemic. But it's also at a time when, on the other hand, when you think about addressing, certain diseases, for example, HIV, TB, and malaria, which is where I work mostly, even though I also work across health systems. But thinking about HIV, TB, and malaria, we haven't seen as much scientific discoveries and breakthroughs as we've seen in the last couple of decades. So we're at a time when you have all these scientific discoveries. You are at a time when, the field is making progress. And then, on the other hand, we are struggling a lot in terms of how do we scale up the financing? How do we make sure that the scientific discoveries, for example, within the HIV space, we are very excited about long-acting PrEP. But also in malaria, we have new vaccines. In TB, we have newer diagnostics and a vaccine, that is almost there. But the challenge for people living in LMICs like us is the question of equity, the question of when do you get to have these products, when do you get to have access to actually this, or are we going to end up being the last in the queue? And so this conversation about how do we increase global health financing is really important at this particular time where we are feeling the shake, we are feeling the crisis, and we are at a very critical juncture. So a couple of reflections in terms of what I would like to see happen given the report, given the context that I've shared, is number one, is to really think about how do we align, even as we go for more money, as we go for more catalytic or innovative financing, how do we ensure that as a global community, we are aligning that with national and regional health financing frameworks? I think that is important because countries have made progress in terms of health financing reforms. Countries need to continue to make progress in terms of health financing reforms. But when we think about the impact of the resources that come to country level, when we think about the equity, when we think about the sustainability of that funding, it really calls for us to really think about how are we aligning with those structures. In the African region, for example, we have, the regional framework on basically you could say it's the African blueprint on investing in health, which is the Africa Leadership Meeting, the ALM framework, which outlines what African Union member states have committed to do. And this is not just about putting more money. It's not just about meeting the 15% Abuja that we know. It actually also comes with some metrics to measure a number of things which are very much aligned with what this report is putting forward. This regional framework looks at, is the money additional? So talking about more money for health. It also talks about, are we seeing impact? Are we seeing better health outcomes because of those investments? It is also looking at governance. How is the money governed, actually? Who makes decisions about the resources? Who decides the priorities? So it's also about the governance space, what policies exist, who is at the table, are communities and civil society at the table and contributing to that. And the fourth thing that is tracked or principle is around equity. Really understanding, even as we talk about additional resources for health, do we have a clear understanding of where we can actually make the biggest impact in terms of communities who are being missed by health systems. So where are we investing? What are we prioritizing? And do we have awareness of who are being missed? So that's really about aligning with those regional and national. The second thing I wanted to speak about, and Didi, you've spoken to, this conversation around sovereignty. We have seen the Accra reset, talking about Africa's sovereignty in terms of how we invest in health, talking about country leadership, talking about really owning our own responses and our health investments. But what I would like to see go along with that conversation of sovereignty is that there isn't sovereignty without solidarity. So I think that global solidarity has a role to play in terms of even facilitating that sovereignty. Like, how do we make it work better? How do we make the mechanisms work better? How do we make global cooperation for health work better? Because I think we need that. When we talk about transition, when we talk about sustainability, we are actually talking about a pathway, because it is never a switch. I mean, if it was a switch, we would have switched it on long time ago. But it is a pathway that has a number of key milestones. And I like to see global cooperation playing a key role. I like to see global health solidarity along those milestones that African nations are really eager and committed to go. And so when we talk about global health institutions, for example, the Global Fund, Gavi, many of them, what is their mandate along that pathway that journeys in an equitable way, in a meaningful way, towards that sovereignty that we are talking about? And the third thing I wanted to offer is to say that we need to scale things that are working well. What is working well? And I think that over the years, we have seen how things like pooled procurement mechanisms have really helped us in terms of economies of scale and savings, and that can contribute to sustainability. We have seen how global health institutions, for example, has supported our thinking around the governance of the structures, the governance of global health financing landscape. From a communities and civil society perspective, it is very important that how we come to the table, how we contribute in these global health institutions or global health ecosystem governance spaces is scaled up, is continued. There are so many lessons learned and benefits of what happens when you have communities and civil society sitting there. And the last thing is to say the progress we've made over the decades has also because that funding has had a rights orientation. So when we think about the funding, a lot of times there's rights frameworks that really have helped us make the progress tend to be dropped. But I think that's one of the things that we need to think about. And of course, think about all of society. When we talk about the shifting global health architecture, when we talk about sovereignty, when we talk about country leadership and ownership, one of the things we like to emphasize is that, yes, you have the government as a stewarding this, but it is all of society coming to the table, including civil society, communities, parliamentarians, all of society. So, Chris, for now, those are the reflections I would like to offer. Thank you.
Thank you so much, Rosemary. Bonanza, let's go to you. And coming from a really innovative country in this space, what are your perspectives on the future of global health financing and kind of things we need to do to move forward the next year?
Yeah, Indonesia, we cannot but emphasize the importance that the Minister of Finance and Minister of Health to be on the same table in addressing the global health, domestic and global health challenges. Yeah. This is why during the G20 Indonesia presidency, we advanced this joint working group, health and finance ministries, yeah. And we continue to advance these collaborations, not only within G20, but we also replicate this at the regional level at ASEAN. So finance guy acknowledge more on the importance of the health sectors as well as both. Yeah, and let me bring this perspective of our experience. Before COVID-19, our approach is more focused on curative care. Yeah. But after COVID-19, we evaluate our system. We have been embarking into a nationwide health transformations that no longer seeking short-term solutions, but we are building a long-term security and resiliency. And in doing so, we have these transformations of health agenda. In health financing, we began with the creations of National Health Master Plan 2025-2029, which provide strategic framework. The plan aligns our national health priorities with broader development goals and address significant funding gaps, particularly in essential medicine, diagnostic, health infrastructures, human resources. We identify a funding gap over Indonesian rupiah 70 trillion annually, or 4.2 billion US dollar, particularly in capital expenditure. Now, to address this, we are leveraging a diverse financing approach that combine public and private investment, social insurance, and development assistance. Yeah. We are also engaging philanthropical organizations and private sectors to co-creator of health solutions, because they play a crucial role in piloting new approaches, expanding access to underserved populations. Yeah. And I would like to bring a concrete examples. We are facing pressing health challenges of TB. We have a good rank from the bottom, not the top. Yeah. We are the highest burden countries after India on TB. As we work on strategy for TB eliminations, we give focus on case findings, treatment, innovation, and TB vaccines research for better prevention. Yeah. And this one, to stop TB by 2030, we aim to increase active case finding using advanced diagnostic and X-ray. And on TB treatment, for example, we apply new BPAL-M regime and HP-MZ regime, and prevention through TB vaccine research and preventive treatment. And engaging health community also important, building an education for community and multi-sectoral support. Yeah. Now, over the past 5 years, we have support from many sectors, including on top of our national budget. For example, through Global Fund, USAID, and United Arab Emirates. Yeah. But in recent year, our new president has prioritized TB in his quick win agenda, putting additional 500 million US dollar for TB control program in Indonesia. But this is related to the questions during these morning discussions. As we see the declining of global TB funding, and this is something that we are also discussing in the Stop TB Partnership Board meeting, we have to act strategically to maximize impact. And we identify at least 3 critical actions. One is enhancing domestic financing. Government must prioritize increased domestic investment in TB. Second, strengthening international support and partnership. Global solidarity remain crucial in this regard. And third, leveraging innovative financing mechanism, creative solutions such as performance-based public-private partnership to attract investment tied with measurable TB program result. Yeah. So those ideas, we are advancing it to prevent the loss of around 23.8 million lives and preserve 13.1 trillion economy. Therefore, we have to put TB in the forefront of our priorities. Now, I'm struck with the idea of having the financial pathway, as the previous speaker highlighted. Yeah. In our perspective, countries has to have this clear financial pathway, using more grant for LMICs, yes. But as country move towards good economic growth, the countries has to identify not only grant and move to mix grant and international loan, another innovative financing, and then move to a more self-sustainable financing should the economy getting better and better. Yeah. And when we reach that, then it is logically that we contribute as a donor. Yeah. And this relates to the role that the World Bank can do and other multilateral institutions can do. Yeah. We look to the World Bank for support through loan management, technical assistance, private sector engagement. Yeah. And through that, we believe that a strong economy means very little if people cannot access the care they need. Yeah. And therefore, health financing is not only about justice, but it's all about making sure that care is not a privilege for the new, not a privilege for the few, but it's a right for all. Yeah. So those are ideas that I would like to put on the table. Thank you.
Thank you very much for those perspectives. Really appreciate that. Agnes, let's close out this first part with your reflections as a leader in health at the leading organization in the world providing financing. What are your thoughts about kind of the big things that need to happen in the next year or so, reflecting on what you've heard from others today too?
Thank you. Let me start by thanking you for this opportunity to engage with you in this forum. And I mean, I read the report that you put together, and I thought it was really helpful in laying out all the different options. But I would like maybe to start by putting this in perspective, if you allow me. At the bank, we've been, for a few years, really paying closer attention to monitoring, what is really happening in terms of health spending in close to real time. And we're about to release, and what will happen given the macroeconomic circumstances of the world and the current turbulences. And we're about to release our next report, and I wanted to share some findings just to put this conversation in perspective. Low-income countries, in order to be able to provide the basic services to people without them suffering financial hardship, need around $60 per capita in public and donor financing, around $60. As of 2024, they had 17. So that's low-income countries, 17 compared to 60, and half of this comes from off-budget development assistance. So, and by 2030, given the current declines envisaged in in ODA, this number is likely under a status quo scenario to drop to $16. So I think this is really a bleak outlook, and so when we talk about domestic resource mobilization, it's really critical. It's becoming even more critical now, and I think this is really ultimately where the solution lies. And so, what do we need for that to happen? I think we need economic growth. We also need, for domestic resource mobilization, not just for health, but in general, to really improve. And this is really on governments. And, I was reading a report the other day of the IMF, which shows that, tax system reforms and increases in institutional capacity could allow a 9 percentage point increase in the tax to GDP ratios on average in low-income countries. So it's really about getting growth, because getting growth brings new money. but it's also about improving the ability to tax. And in that, I think we haven't, it hasn't come up yet, but I think health taxes really have a role to play. Not just because, not just because they will bring more revenues to the government that can or be allocated among other purposes to health, but also because it will help contain, and Mr. Booty is very vocal about this, it will also help deal with the sustainability, because it will ultimately result, reduce the amount of spending that is required. So tobacco taxes alone represent an untapped fiscal gap of 1.5%, 1.1% of GDP. So I think that's, if we have one priority, that can be one. The other one is really about, the political choice to increase the share that is spent on health. I mean, we talk about Abuja, but if we look at the reality, it's not happening yet. The share of health in government spending has stagnated at 6.1% of GDPs. 6+1% of available, domestic public spending between 2018 and 24. In fact, over the same period in lower middle income countries, it has decreased from 7.1 to 6.3. So, and yet, 1 in 3 low and low middle income countries has the fiscal space, or is predicted to have the fiscal space over the next few years to be able to increase the priority that it is giving to health in their own budget. Because these countries are countries that are spending less on average on health, or prioritizing health less than their peers, but their fiscal envelope is set to grow. So there are, even for countries, today, there are options to change this. I think, so there are options there. So really domestic resource mobilization and prioritization of health. Now, I think you would all be disappointed if the World Bank didn't talk about efficiency. I mean, let me be clear. If you spend $1 where you need 3, efficiency will only get you this far. I mean, we need new money. There's no questions about this. On the other hand, if you have $1 and you leave 13 cents on the table every year, this is unfortunate. So simply, budget execution in health on average in lower and lower middle income countries is, 13% below what is, people leave 13% on the table, countries leave 13% on the table. So this is something that health can do. And it's not just about spending the money you have, but it's also, if you are unable to demonstrate that you're using the money you have, how can you ask for more, right? So I think the public finance management agenda is really an important one. But it's also about, the priorities, right? So we really want to focus on integrated care. And I think in particular, low-income countries that have, historically depending a lot on external development assistance, and they really have an additional opportunity right now to really integrate service delivery and make sure you don't have parallel systems that deliver services to different segments of the population. So I think doubling down on efficiency is also part of the solution. And I do, just to finish, I do think that integrated primary care platforms are important for efficiency, because this is really the most cost effective and you can integrate services. But it's also about equity, because if you bring services closer to the population, this is where you're going to get the opportunity to reach populations that you don't reach. So, but all of this, at the end of the day, it's a matter of political will, and I think civil society really has a chance to shape that political will. So, yeah, over for now. Thank you.
I really appreciate that. And so thanks to all our panelists. So let's do a quick follow-up question round right now. And then, and so if people can be brief in their responses, that'd be great, so that we can have plenty of time for Q&A with the audience. We've heard a lot of great ideas from all of you already about leveraging innovative finance, about the rights orientation and equity orientation of doing this work, the need for political choice. What are, one thing I want to ask is, though, one thing we haven't talked about yet is the specific innovative finance mechanisms that you see as holding great promise. Obviously, as we've said, we need to continue to invest in overseas development assistance. ODA needs to become increasingly catalytic and play a role in bringing in new resources. Domestic resource mobilization and the taxes to support that are absolutely essential. And there's a whole variety of other kind of innovative financing, purchase blended finance, debt to health, debt relief, SDRs. What of these specific financing elements are most promising or exciting to you? Or is that the wrong question right now? Is the right question rather, we need all of them and we just need to scale them? But I'd really love to kind of hear if there are perspectives from each of you about what financing mechanisms you're looking at as providing real promise. Ndidi, why don't we start with you?
Thank you so much. The short answer is that it's not a one-size-fits-all. It's going to vary by country and by context. As I mentioned, we're currently piloting pathways to sustainability work in Sierra Leone and Senegal. We picked those two countries with the support of our partners because of the first issue, political will. The second, the recognition that this was a priority of the government and a priority of partners to come together. I think paramount to this, and I think I'm building on the point that was just made, unless we have coordination on the pathways, and I completely agree with the coordination on the pathways from the global health architecture perspective, we'll continue to have this siloed approach, which creates inefficiencies and actually creates confusion in the ecosystem. I think a recent op-ed that Raj Shah published in the New York Times, for those who didn't see it, I think, quoted that Malawi, the country of Malawi, has 55 different contracts with different providers of services and engagement. Everyone we've talked to in governments on the African continent have told us, please help us get the global health architecture to work for us, as opposed to in silos. So I think the World Bank has an important role to play. So does Gavi Global Fund, WHO, UNAIDS, UNICEF, the whole UN architecture and infrastructure. But also African governments must demand that they come in together. So that agency is important, because even with this health financing, there's now a new set of players. Every day we hear about a new initiative that has emerged. And I'm a big believer in saying, let's not create new initiatives, let's actually work together. And so at the One campaign, one of the things we really would hope for is that all those who are talking about health financing today come together and streamline their efforts, their pools of resources, their mandates to governments, and their approaches. Otherwise, we will fail, and we'll create a lot of wasted time and energy and sleepless nights on many fronts. And ultimately, who will suffer? The most vulnerable, who we say we are designing and caring for at the moment. So that's my big message. I would say, from our perspective, what we've seen in Senegal and Sierra Leone is that it's a mixed bag of approaches. For Senegal right now, because of the debt crisis that they're facing, which is quite pronounced, the debt for health swaps seems to be the one that's gaining a lot of momentum. The increase in efficiency and effectiveness is number two. It's still early days. And number three is the diaspora remittance support for health insurance, because a very strong diaspora connection that Senegal has with diaspora in France. Cost of remittances is very high. 14% already goes to health. That's a significant amount of money. How do we unlock it but reduce the inefficiencies, et cetera? So for me, I think that's each country is going to be different. And I think if we force one mechanism down the throat of a country, we might fail as well. So let's start from what is needed on the ground and design together from a holistic perspective with a clear roadmap and accountability on both sides, the country side and the global health support side, so that we can come back each year and really say, where are we? So that's my appeal. And I think, Mark, we can do a lot more to raise awareness about these multiple initiatives going on and call them out and say we need just a few streamlined approaches. Thanks.
Thank you. I'm Chris, by the way, just to be clear.
Apologies. I was saying Chris, and then I turned to Mark. Apologies. I know who you are very well. It's just We miss you
It's all-
in DC, so that's why I'm getting the names confused, Chris.
Okay, no problem at all. Happy to be mixed up with Mark. Rosemary, you talked about the need to align with national and regional frameworks. And we've just heard from Ndidi about the need to, streamline and work together. I mean, when we have all these multiple different tools, right, to use in finance. What does that look like to you in the next year or two? I mean, how do we move towards that alignment, designing together, working with countries to design approaches based on what their needs are? What's the next step in that alignment you're looking for?
Yeah, so that's a really difficult one in terms of the alignment, the coordination and all. But I think agreeing with Ndidi in terms of it has to be very country specific in terms of what models, what mechanisms will work. But I think that if the players can be guided by certain principles, whichever innovation the country ends up, I think the players really has to be aligned in terms of the principles and to get together. And some of the things we've already mentioned, because ultimately what we want to see is the impact on people in terms of putting people at the center. So the principles, if partners can work around making sure that the principles around additionality, impact, equity, but I think the one we haven't mentioned is also the principle around every financing mechanism or program needs to also think about financial risks protection. When Agnes was speaking about the coverage and how much money actually is at the country level and all that, there is a comment you made about the catastrophic out-of-pocket expenditure being like one of the biggest contributions to the health budget. And so I think that's an area where we can align better as a principle. So perhaps not a particular innovation in itself, but I think in terms of getting the results that we want to see, making sure that the billions of people who are at risk of catastrophic out-of-pocket expenditure are also catered for, along with the other principles. But the other two things I wanted to mention is if partners can align around efficiency gains. The presentations here have been very clear on how we can leverage that. But the other component, for me, especially for many countries in Africa, is to think about a health systems model that relies more on prevention and promotion of health, as opposed to a model that relies on curative. This is something that many African countries have done many years ago, just really strengthened their public health systems, health promotion, the prevention angle, making sure that their youth are well equipped with the knowledge, with education, and really just leverage that and move away from a reliance on basically a curative system. And I think that's why we end up with a huge burden, because that also ends up being very, very pricey. So I think, Chris, I'll leave it there for now. I've remembered we were supposed to be brief, but I'll leave it there for now.
No, that's wonderful. And, Bona, you talked about how one of the, four things that were really priorities for you going forward was leveraging innovative finance. So I'm really interested in your thoughts about which of those mechanisms out there are most interesting to you that you'd really like to see scale, specifically of the mechanisms available. What would you like to see developed, at least from Indonesia's point of view? And then also, just to say, Indonesia has been a real leader in utilizing financing tools, particularly on tuberculosis, a long history of debt to health swaps, a landmark blended finance deal, combined with really extraordinary leadership from the Minister of Health. And so just, can you talk about the process of bringing those different financing tools to bear, and what lessons you learned from doing it.
Yeah, thank you. Our national healthcare per capita is 130 US dollar, with the result of 72 years old. Anya mentions about the LMIC investment. Yeah, US spend 11,000 US dollar healthcare per capita per year, with the result of 78 years old. Yeah, so we are looking for the how is the most effective. Yeah. Let's compare with Malaysia. Malaysia has 430 US dollar healthcare per capita, with the 76 years old turnout. Yeah. So imagine in 5 years, Indonesia is getting more healthier. So we will reach Malaysia level, in which we have to spend another 300 US dollar times 280 million people. So it is 84 billion US dollar budget to be spent. For finance minister, this is a burden, but for private sector, this is a opportunity of investment. So this is something that we put always in the discussions. Yeah, Pak. Now, we are sitting in the board of Global Fund and Gavi, which is this year alone they trying to replenish 18 billion for Global Fund, 10, 12 billion for Gavi in the current situations. Yeah, then we have to think creatively. This is why we always advocating money is there. Is it easy to say because we have Minister of Health Indonesia coming from banking sector. That's quite confident that money is there, but how to utilize it better? And this is the discussion that we have with World Bank, how to utilize it better. So now we are implementing 4 billion US dollar loan consortium from World Bank, ADB, ISDB, AIIB, yeah, to strengthen our primary care network, preventive approach in this regard. So 300,000 primary care, 10,000 puskesmas in 415 cities. We are trying to upgrade 414 cities hospital with CT scan, MRI, mammogram, cath lab, chemotherapy facilities, yeah, etc., etc. Yeah. And in doing this with innovative financing, we can bring tomorrow to today. Yeah, and this is something that we are advancing in terms of putting a good and effective access, a good quality, and better services to our populations. Yeah, and that 4 consortium of multilateral development banks, we managed to squeeze them to have a mechanism in the implementation stage. You can imagine 4 banks with 4 different approaches, and we managed to make them sit together and agree into one mechanism, and we are using the World Bank procurement mechanism in this regard, so that there is no hanky-panky, less under the table conversations, more transparency, etc., etc. This is something that we are putting in our healthcare landscape, and we hope that this conversation also amplify at regional and global level. So ODA, in our experience, it's beautiful because of their flexibility in nature and filling the gap. This is something that we value for this ODA, but also it has to become with a good knowledge on technical assistance and also engagement with the network. Yeah. Thank you.
Yeah, thanks. And it's just interesting. I'm hearing a lot about the opportunity to do even better in terms of alignment, collaboration, information sharing. Bona, you just talked about, bringing 4 multilateral development banks together to create one mechanism that you can work with. So sounds like there's a lot of things there, opportunities in terms of greater collaboration and coordination in how we move forward with all the myriad options we have. And Agnes, can you, end out this segment of the conversation, and just based on what you've heard and what's going on at the bank, I mean, what is the World Bank doing in terms of supporting the various options we're looking at, and what do you see as the biggest opportunities in the next couple for growth in these areas?
So I think Bank Bonanza just explained it all, right? I mean, I think they're really keeping us on our toes and keeping us awake at night to really, I really think fundamentally that, it's in the World Bank's DNA to serve the government's priorities. And so we have instruments that are designed to do precisely that. I mean, if we look at the P4R, which is what we're using in Indonesia, is really programs that support and push and leverage the whatever the public financing that is available to really focus on results. And I think it was one of the principles you outlined at the very beginning. So really working with the other important thing I believe that the World Bank tries to do, I mean, it's by a sense, it's on budget. It's on budget, so it's aligned with the government priorities, and I think this is really something that is important. And the third element that also is prominent in the Indonesia case is really what we call co-financing, and I know co-financing means different things to different people, but it's really putting the money together and commingling the money and commingling it with the budget, the government budget, to really push the priorities equally. And I think even the bank has worked on the debt for education swap recently, and we're really also looking at doing this in other countries. And it's really about making fiscal space and combining this with a P4R that really puts additional money in the government program, not outside, not separate for specific priorities, but really in an integrated way. And there, I would like to just for a second really take my health financing expert hat to really talk about defragmentation, because I think a lot of the issues we talk about are really about having separate pools of funds for different purposes, and this really creates huge inefficiencies. And if we create this new mechanism to finance this or this new innovative, it creates fragmentations intrinsically creates inefficiencies. So it's really about pooling of resources at the national level rather than adding new schemes or new mechanisms that will, by a sense, require to be managed separately and so on. So it's really a plea for defragmentation at country level also of financing health systems, which is really challenging when you have, the local governments that is financing this and the donors that is financing that and the central government and then the insurance scheme. It's really, it creates inefficiencies. So let's try to really defragment. Thank you.
Okay, great. Very clear message. Thank you. And now let's move to questions and comments from the audience. And I'd welcome those in the crowd to step up to one of the mic stands in the room. I think there's one directly in front of the panelists. And maybe Isabella, you can let me know if there are people there or how that's going to work.
It's not working. Can folks, yeah, there we go.
Yes, and please introduce yourself. Thank you.
Thank you very much. My name is Abdikarim Habib from Sierra Leone. I'm actually partner to Gavi, and for health financing, I was thinking maybe those who do the report should have to actually add sustainability, because for us in Sierra Leone, we are now talking about sustainability in all the gains we are making. How would that be sustainable? Indeed, they talk about that actually, but how do we learn from at global level what's sustainability strategy? Because we are thinking about maybe having law on immunization, right? And how corporate institution we have a basket fund for health. So corporate institution which actually put some amount of contribution to that basket. So that will also support government. But at global level, what sustainability strategy we may learn from in this meeting. I'm here sleeping without mosquito bed net. But here back in Sierra Leone, I don't do that. Malaria will be injected in my vein. So every two or 3 years, we distribute a mosquito bed net. So what strategy do we really need to put in place to do our mosquito in our continent? Because mosquito is the carrier of malaria. And distributing mosquito bed net is not something sustainable. We should think about do our with mosquitoes. So that strategy we may want to learn from global level. What global strategy we should put in place that might be sustainable for health? Let's say, for example, Mpox was in our country, is now going back, but people came large in taking the antigen because of the monkeypox, where it started on us. It is from the genital area, and we always very careful, sensitive about our genital area. So people were taking, that vaccine without existence. People were going for it large number. But we'll be having a nationwide mark for HPV uptake from November 13 to 19. All of this. So this huge gain we are making. For us, my organization, we have been going to community, subnational level, engaging community for HPV mark, going to MOXIS. Before that, Gavi was need to be economical to work with civil society, but we have changed that narrative in Sierra Leone because they were in Sierra Leone just now. They realized that civil society has actually changed. So that's where also the issue come with localization. Because before now, Gavi just supports government. So we are making that kind of change. So all this actually come to sustainability, So at a global level, also want to learn from you. When we go back home, we can be able to add to our strategy we have for sustainability.
Thank you very much. And maybe we can take one more question and have our panelists respond to a couple, but certainly hearing you, strongly, let's look at financing options and where we go with a lens of how do we make this sustainable? What do we need to be doing now to really be focusing on making it sustainable? Shall we take one more question?
Okay. Hi, thank you so much. My name is Kim Whipke, and I work with FP 2030, which is an initiative that aims to expand voluntary access to modern contraception. I actually have two questions, if you would allow me, Chris. The first is that, I'm an advocate at heart. I've done advocacy for reproductive health for a long time. That is sort of my area of expertise. It's overwhelming trying to understand the financing landscape and sort of where civil society can actually add the greatest value. You know, even in this panel, we've heard about so many different areas that need attention, from just traditional DRM and strengthening that, to debt relief, to innovative financing mechanisms, to how do we support governments to better mobilize revenue. Like, would love to hear from panelists recognizing that there's no one-size-fits-all solution, but also that our energy as advocates and our expertise is finite. Like, where should we build muscle? Where do you think we can have the most impact where we intervene with our advocacy efforts? And then just the second piece that I wanted to raise is that I really echo this need to come together across our health areas, across our sectors, but also just want to put out there that it's also a fraught space when politics get injected. I mean, I'm following what's happening right now with the U.S. government, you know, what's happening with these bilateral aid agreements, also discussions running parallel around a majorly expanded global gag rule that can roil not just countries, NGOs, but the multilateral system. And sort of just if the panel has thoughts on how do we work together when there's like really a potentially divisive political landscape that is really trying to separate us and make us continue to work apart. Thank you very much.
Thank you for those questions. Panelists, let's go back to you with your, I'd love to hear from each of you actually with any response you'd like on these questions. But just to summarize, again, how do we set things up now so that we're taking advantage of the opportunities country by country, but really with sustainability in mind? What does that mean to you? And I really want to emphasize Kim's question, just for my own selfish interest really, is from your perspective, what can advocates be doing to advance the agenda that we're talking about? So let's go back to our panelists. Ndidi?
Thanks, Chris. And just to underscore, excellent questions, and thank you to those who are standing patiently waiting to ask theirs. I would say two things. I would say number one, and I really like that question about us coming together. I was at a cocktail earlier this week, and a lady came up to me and she said, they are organized, they are funded, and they've been preparing for 30 years for such a time as this, and we are fighting ourselves for crumbs under the table. And honestly, for me, that was the best summary of the situation. I don't think we understand how urgent and important unified voice is at this time, where we are not focused on our logos and our egos, but are focused on the most vulnerable. I often tell people when we have these debates over things that are irrelevant, that we have a common enemy. It's disease, it's poverty, it's death. We are not each other's enemies. And I think that is a fundamental component of this time. And it's really about, let's reaffirm our values and who we're fighting for. And that is something I think, Chris, we as a sector need to elevate and actually have some very candid, closed-door messages about what it will take. It will take not only some mergers in our sector, it will take some of us committed to working ourselves out of a job. And you can't imagine this question of sustainability you raised, sir, that people have told me as I've gone around to talk about our vision, that by 2035, no African country should be dependent on any other world region. They've told me, I don't see myself in the future you're painting for Africa. Like, I'll lose my job. And I'm like, isn't that a good thing? That you lose your job? So, in fact, this message that we have so much innovation right now, we have AI, we have technology, we're so close to ending many of the challenges that many of you have fought so hard for. Let's finish the job. Let's finish it by working ourselves out of a job. And we can take on new challenges. There are lots of challenges. And how would I prioritize them? I would say, ultimately, it has to be done at the country level. That prioritization has to be done at the country level. I'm new to this advocacy world, but it never ceases to amaze me when we put an agenda on the table, somebody raises their hand. You've forgotten the indigenous people. You've forgotten the women. You've forgotten the children. And then at the end of the day, we have everything but nothing, right? It's so watered down. And each country has to make a hard choice to say we have limited resources. what is the most pressing challenge? And I love Bonanza's approach. Bonanza says, and you have a finance minister as your health minister. That is actually a recommendation to put at the table. Let's find finance ministers to become health ministers. He's looking at life expectancy and dollars spent per person. And he's like, if it's going to take, to get 4 extra years, this is how much it's going to take. Is it worth it for us? Or should we focus on mental health, right? Because maybe in some countries like Japan, it's suicide rates that is really a #1 killer. In Nigeria, it's still maternal mortality. That's where we still are. So while mental health is important, maternal mortality is top. So that prioritization has to happen at the country level, and donors need to stop ramming down our throats what we prioritize. And our countries have to get better at saying, this is not my priority right now. My priority is maternal mortality. So I'm putting this on the table to say that these guiding principles, maybe we should, results and Friends of the Global Fight should work on some guiding principles and an alarm for the advocacy ecosystem. It needs to reform with sustainability at the front, with working ourselves out of a job as a key guiding principle. But also this North Star I laid out, that's the North Star we've set for Sierra Leone. By 2035, no other country should be funding Sierra Leoneans health financing. And Sierra Leone's life expectancy under 5 should be, next to nothing, right? You guys won't have one of the highest still, but you've reduced it significantly, this under 5. But if that's your priority, let's set it. And that is our North Star. And sustainability means the private sector is driving and the public sector is creating an enabling environment, and donors have stepped out, right? That's what my vision is for Sierra Leone as an African, and I think we can achieve it. So back to you, Chris.
Yeah, no, wonderful, and thank you for that. I do want to note, you've noted the private sector too, and just to say, one works very closely with the private sector, so does Friends and many other organizations. That's a whole other aspect I think we can bring to this conversation is bringing the private sector to the table in country and talking about the opportunities there. Do other panelists have responses on either of these two great points, both on sustainability, but also what can advocates do right now?
You can start.
Oh, all right. So I wanted to say that in terms of what advocates can do, just being on this panel has reminded me how much data we still need to get. As you were presenting about the health financing situation, how much gets left on the table, and so on and so forth, I think there is quite a bit that we can do as advocates in terms of just equipping ourselves with the data. I think understanding more about public finance management, I think if we're going to approach the inefficiencies and all. So I think that's one, but also think about the intersectionalities. How do we, as advocates within the global health space, get together with advocates who are in the tax justice and debt relief and all the different components that go into health financing. And the second thing about sustainability, I was thinking that in the end, we need to outline some short-term goals, some medium-term, and some long-term. I mean, there's a lot. And I think in the short term, to the question about malaria, my brother here was talking about malaria. I think in the short term, I'm obviously biased because I also work around global health advocacy, and I mean global fund advocacy, very much noting about the comment around fragmentation, but really right now the opportunity we have with the global fund replenishment right now, which is happening as we look at scaling up malaria interventions and everything that is happening there. But in the medium term, how do we ensure that the money raised through that mechanism, then there is better alignment, there is better coordination? And I think in the much longer term, how do we ensure that we reduce the fragmentation? I think that's what I wanted to offer towards that. Thank you, Chris.
Thank you, and I do appreciate you noting its Global Fund Replenishment Year, and I think it's fair to say one of the most significant positive things that could happen in global health financing in the near term is a successful Global Fund replenishment. So urging that for all our discussions. We have about 13 minutes left. Are there any burning responses to the great questions we've had so far from our panelists, or shall we go to the other questions in the room?
Take the room, Chris.
Let's go to the two of the other questions, please.
Hi, good morning. My name is Linda from Oxfam, and I really want to appreciate the panel for the range of topics that you've covered today. There's a lot to be done, and there's a lot that's resonated with me, including sort of national, like countries taking the lead and being in the driving seat. But I want to turn back a little to the innovative financing question. There's lots of things being proposed, but I would like to know, how are you embedding accountability and safeguards within those mechanisms? We work a lot on blended finance, the impacts of blended finance on human rights and communities. So I would like to understand like how you're approaching accountability and ensuring that equity is something that's at the forefront of some of those mechanisms, and that profit maximization doesn't lead to like negative impacts for communities. Thank you.
Wonderful question. Thank you. Is there another question?
Yes, hi, good morning. My question is for Agnes. Agnes, I'm Daniel Updegraft from Philips, so a pleasure to finally coincide with you in DC because, yeah, it's a, but thank you for your comments. So among your various recommendations, I heard there will be a need for new money, right? And so kind of in view of the bank's commitment to expand affordable health coverage by 1.5 billion people by 2030, I would love to hear any comments you might have about what is the bank's role in this, new money. I know the bank lends for healthcare, in a given year, maybe $6 or $8 billion. Do you envision that increasing or kind of what's the direction? Thank you.
Excellent. Thank you. Are there any other questions, or should we go back to panelists? Let's go back to...
Yes, Chris, if I may, on Oxfam ideas, when we design this proposed multilateral development, the consortium loan, the proposals touch into principles of equity. It means in which that we want the populations of Indonesia across 17,000 islands to have good access. Yeah. So one of the design is to zoom into village level availability of medical equipment, and then move up into city level, and then move up to provincial level, and then central level, so that the service delivery is there with a good thinking of addressing a quick response, also making a good referral system, and referral back to the community facilities. Yeah. So part of the designs is that, and we've been in the discussions with World Bank, with other multilateral development bank, how that's also attract their principles. Yeah. And when we are in the same frequency, I think that's something that we can bring all in the table. This is something that the experience that I want to share. And back to the advocacy role. One example that I would like to share is how Indonesia embarked into a more scale-up cervical cancer eliminations. Yeah. Minister Budi was reminded by UNICEF back in 2022 after COVID-19 handling that in the past we have this pilot project nature of the cervical cancers, and it's not into a scale up. Yeah, and then UNICEF advocate us with the community in the Asia Pacific region. The U.S. Also advocate us to embark into this cervical cancer that is preventable. So in that perspective, we learned that if partners come with good ideas and proposals that can help us, we are open to embark into that strategy. Therefore, now we are scaling up our National Cancer Action Plan that also covers boys, and we start the vaccinations hopefully next year for this cohort of boys 11 to 12 years old. So, thank you.
Great. Other thoughts? Mm-hmm.
So perhaps I can now answer the question that was directed to me, and I want to thank you for asking it, because I would probably have been scolded by my bosses if I hadn't had a chance to mention this. But indeed, I mean, I just to step back. I mean, I think it's fair to say that when the COVID crisis hit, countries and global institutions really rallied to invest in health. And notably through additional spending. But what we saw, and sorry, I'm a numbers person, but actually even governments after COVID, the priority, the budgets, the share of the budget they gave to health decreased to levels below what they were before the actual crisis, right? So I think there was a sense of, well, you've had your moment, in health, but now, let's go back to real business. And I think this is really something we have to fight, and we've been trying to fight even internally at the World Bank. And I think this is partly, the start needs to change, the change, needs to start with ourselves. And I think this 1.5 billion, challenge that the president put to us is for us in the health sector, an opportunity to really advocate even internally for more IDA funding that to be going to health. And I think we have a good case. Again, it's going back to the earlier side of the conversation about really making the case that health is an economic investment. It's a driver of growth. It's a driver for jobs. I mean, in low middle income countries, a job in health generates 3.4 more jobs, for in related sectors like pharma, biotech, digital health, and so on. So it's really, giving, putting money where putting our money where our mouth is. So we really want this. Obviously, the money the World Bank can put is only a drop in the bucket of that, $1 to $3 gap that we were talking about earlier. But I think we can use it as a catalyst, and we have. So later today, there is this meeting to which you will participate around this initiative of Health Works to really try to also mobilize energies around this behind the health compacts and the UHC forum, which is taking place in Japan, co-organized by the Minister of Finance of Japan, WHO, and the World Bank in December, to really try to rally donors around, again, streamline priorities behind which everybody aligns that are set by the countries. And I think we're actually discussing with some foundations, and I think there will be there will be announcement made around this, so that for us this 1.5 is a bit of a catalyst, but really to also get others to pitch in and align themselves. So I hope I have answered your question. I'm delighted to finally meet you.
Sorry, I just want to add, given that we also will be crucified by a team. We have a phenomenal data portal, since data has come up quite a bit. And at ONGA, we launched a health data agent. We partner with Google, and we have a one-stop shop for health and finance development data. It's free. It's available. Please check it out, data.one.org. We're scaling this, and so we would love for more partners to come alongside us. And this data should inform not only policy making, advocacy support, media engagement, but also how our countries pivot and how they leverage whatever aspirations they have to ensure sustainability. So please do check it out, data.one.org. We have a lot of really phenomenal analysis, and we want to get it into the hands of more people. So please, let's think about how we can leverage that opportunity. And then the last thing I'll say is, for me, ultimately, this report is such a gift. So thank you, Chris and the team, for pushing forward. We need to build on it, and really what comes out of it is going to be what the impact we make together as a sector. And I think aligning those values, aligning the priorities, and then pushing together to continue to drive momentum for transformation is ultimately what will, the legacy we can leave for future generations. So one is committed to this partnership, and we look forward to working with many of you. Thank you.
Yeah, Chris, and I also want to come in and say that the report also has a section that speaks to different stakeholders. I think to the question about where do we start as civil society, there's an outline of what civil society can do and needs to do, what donors can do, and so on and so forth. And I also wanted to conclude by reflecting on the question from Linda about accountability, saying that ultimately accountability is to the people. Noting that, you know, with the latest global monitoring report for UHC, we have, you know, about 4.5 billion people around the world who do not have access to essential health services. And that's like half of the world's population. And then you have 2 billion who actually are at risk of catastrophic out-of-pocket expenditure when accessing health services. So ultimately, is all these, as we expand health financing, as we look at the different mechanisms, the impact and the equity that has to come with that is, I think, is part of the accountability. And the last piece around accountability, for me, it's the more reason why the civil society work we do is important. And why it needs to continue to be supported. And not just civil society. We also have members of parliament who play a very critical accountability and oversight role at the country level. And when we think about public finance management, as it has come a lot through here, I think members of parliament and civil society can support a lot on that end. Thank you.
Wonderful. Well, we're at time. I want to thank all of our panelists. This has been a really outstanding conversation. And, you know, as Ndidi says, I feel like it's a foundation for really moving forward together to talk about principles for where we go next, what the opportunities are, how we can increase communication and collaboration in this space. I've heard a lot about how approaches need to be country specific. We must be thinking about rights and equity as we go forward, that the political choice for health investment is important to keep mobilizing. Think about efficiency and integration as key aspects when we talk about financing. Again, this need for, you know, guiding principles and methods. I would love to see One and Results and friends work together on, and Wacky Health too, and others on driving forward this agenda. I really appreciated Rosemary's comments about, you know, that we need to educate ourselves. We need more data and understanding in this space to be effective advocates. And that's a place we can work and also partner with advocates in other spaces like in tax justice. I thought that was a great point. So let's collaborate, let's work together, let's drive this agenda forward. I think this was an outstanding conversation. I want to thank everyone for coming. Please do reach out, everybody watching and in the audience, reach out to friends or One or Results with any questions or comments about where we go from here. And the report is available on the website and also in the room. Thank you so much to the World Bank for being our hosts.
Recording stopped.